The CDC guideline continues to create challenges. One of those challenges, of course, is misinterpretation by not only policymakers, but also practicing physicians and other healthcare providers. The CDC guideline itself was a good idea, but the way that it was brought about, the procedure that was used, the people that were invited, the process itself actually negatively impacted the end result. And the end result continues to create problems in the areas of misinterpretation. What would be helpful if the CDC would do, of course, like any type of government entity regarding any type of policy, is to evaluate it for its impact, both intended and unintended impacts. And if corrective action is necessary, it should be taken. Unfortunately, despite them being informed of the problems, nothing has been done. One solution to improve the CDC guideline is actually make sure that all relevant stakeholders have a seat at the table and to be able to provide that input. Now, of course, not everyone will agree, but it's important for everyone to be heard. And so what can solve, I think, some of the problems associated with the guideline is to evaluate it for its impact, its unintended impacts, as well as its intended effects, as well as highlight the problems associated with involuntary tapers, which are, of course, occurring across the United States, and also highlight the primary role that illicit opioids, such as heroin, are having on the overdose rate in the United States. Unfortunately, an awful lot of the data has been conflated regarding overdose, specifically in regards to the role of opioids, illicit opioids, those that are counterfeit or those that are heroin, versus prescription opioids. And there's been a variety of reasons why that data has been conflated. One of them is, of course, just ignorance. Policymakers not being able to articulate the differences between the two. The other one, significant contributor, is the ability of medical examiners to be able to test for that and the resources that are necessary to distinguish between illicit opioids and prescription opioids. So the narrative that all opioids are bad is an easy narrative. Unfortunately, of course, the devil is in the details. There is a great deal of variation across the United States and world as far as how regulators are facing the drug abuse pain treatment problem. Of course, there are international treaties that are involved, their own domestic policies that are involved. Is there one particular model that we can look to? Well, currently not at the time. There are models that have positives and there are models that are negatives. And when we're dealing with the international community is that oftentimes people talk about how we have so many opioids, prescription opioids, compared to other people across the world. Well, oftentimes the ability to access opioid medications for the treatment of pain, whether it be cancer, end of life, or non-cancer pain, is extremely limited internationally, and particularly in third world countries. We have a present problem not only with pain treatment, but we also have a problem with prescription drug abuse, overdose, and death. This was very similar to the problem we had 20 years ago. And now we're kind of where we were 20 years ago, but things are worse for not only people in pain, but also those suffering from abuse disorders. So 10 years from now, what we will probably find is another swing of the pendulum. And what that pendulum will look like will be difficult to actually predict, because the overarching frame really should be this idea of the reduction of unnecessary human suffering, so that we don't get into this game of a zero-sum game mentality of it's either pain treatment or it's preventing abuse. And so if we go with this framework of the reduction of unnecessary human suffering, we would be concerned about those who are suffering from opioid use disorders. We would be concerned about those that are being not treated adequately for their pain. We would be concerned about options, alternatives that are safe, effective, and covered by insurance.